People say that you need to build a strong core in order to prevent injury and overcome back pain. The problem is when you're training your core or training your abs, you can often feel back pain and it feels like it's making the problem worse. So in today's video, I'm going to explain why you get back pain when you're training your abs and what you can do to prevent that pain coming on even when you're doing those same exercises. Now, first, we need to look at the anatomy of your hips and your spine, because I believe if you know what's going on, then you can understand why you're making these changes. So let's hop on over and have a look at the anatomy, and then from there, we're going into the exercises as well. So when we're talking about building up abdominal strength or core strength, one of the reasons we want to do that is to create stability within the spine. In terms of the anatomy and talking about the pain that you're getting in your back, what we need to look at is first of all the function of the abdominals. When we're training the abdominals, we either want to make them tight, so we create a lot of stability in the spine. So for example, doing a plank, or we are contracting the abdominals to flex our spine, so to bring ourselves down like so. When we do that, there's two things that can happen. One, we can either flex from the spine and keep the legs and the pelvis stable, or we can keep the upper body stable and then flex through the hips and through the pelvis. So an example of both would be a crunch. So we're crunching up and down like this, or leg raises where we're hanging and then we're pulling the pelvis up and down. The reason for telling you that is because we need to then look at the psoas muscles. Now the psoas muscles, there's two muscles. There's the psoas major and then there's iliopsoas. If we look at this model here, this is a model of the right pelvis. This is the inside here. So as you're looking at the spine from the front, what we're looking at here is the muscles on the inside of this bone here. This muscle you can see here is the iliopsoas. This one that's been cut is the psoas major. Now this one would go all the way up and attach into your lumbar spine. So the psoas major comes up and attaches onto the 5 vertebrae of the lumbar spine. These white bits sticking out here, these are the transverse processes. The psoas major attaches to the front side of the transverse processes. What that does is it then comes down and attaches onto the front of your thigh bone. So when you are, say, lifting your leg, it's the psoas, also known as one of the hip flexors, it's the psoas that's contracting. So for example, if you're hanging and you're lifting your legs up and down, iliopsoas and the psoas major are both being used to lift up your femur or your thigh bone. So the reason why you get back pain when you're doing abdominals, one of the reasons why you get back pain is because where the psoas attaches to the spine, the psoas or the hip flexors generally are quite weak in most people. So as you're doing your abdominal work, what's happening is you're getting that burning sensation like you do if you get bicep curls or if you do squats, you get a burning sensation in the muscles, right? So when you're doing these hip flexors or sit-ups, this psoas muscle is being used and it doesn't have the endurance in it that the abdominals say do. So what happens is that burning sensation, you're feeling it where it's attaching into the spine. And that is giving you the sensation of back pain. So actually the pain you're feeling, generally speaking, when you're doing abdominal work is not coming from the actual back, it's coming from the psoas major muscle burning from the exercise that you're doing. I just wanted you to know that because first of all, I want you to know that it's probably nothing bad, nothing to worry about. And secondly, then you can go and do something to correct it. Now, what I will say is if you are experiencing low back pain and it hasn't been diagnosed, then go and get it checked by someone professionally first. You should never go and do exercises where you're feeling pain and you don't know what the reason is. Now, the other thing that can happen when you're doing abdominal work, One of the most common core exercises that you see people do is a plank. So that would involve you being in a prone position, supported by your elbows and on your feet or on your knees. Now, I'll demonstrate this in the gym as well in a minute, but one thing to note, when people do plank, sometimes if they're not in a stable position or they're getting tired, their lumbar spine, so their lower back, can end up arching backwards or going into hyperextension. Now, what you might be able to see is as it goes into extension, those spinous processes are coming together and causing compression. So another reason that you can get back pain when doing abs, especially if there's extension involved, is there's too much extension, and that's causing either compression of the spinous processes or the facet joints where the vertebrae overlap. If you are experiencing back pain, first of all, go and get it checked out by a professional. Make sure you get a diagnosis of what's going on. But secondly, maybe you've been told to do your own exercises or do some rehab, or you just need to strengthen, but maybe you haven't been given enough guidance in that process. Now, wherever you are, whether you're in acute pain or chronic pain, I've got an ebook all about low back pain that I think would be perfect for you. It will take you from where you are right now, whether you're in acute pain or chronic pain. It will help you understand why you're getting pain, and it will take you right through the stretches and the exercises, including a stretching and strengthening plan that you can do at home. So if you are experiencing low back pain, then check out my ebook in the description below. So these exercise variations, so the sit up, the plank and leg raises, can all cause lower back pain. It can apply to other abdominal exercises too. The principle remains the same. The reason for it is because the hip flexor, where it attaches to the lumbar spine, is being pulled. It's the origin where it attaches to the lumbar spine is being pulled on, and that kind of lactic acid buildup where the muscle is probably quite weak is starting to burn, starting to feel like you're getting back pain. Now, as you can see in these clips, when I was doing the sit-ups, the legs are kind of remaining in place. So what's happening is we're flexing from the hip and the upper body is moving. In the later few reps, what you can also see is my chest coming up and my lumbar spine is extending. And you'll see this sometimes when people do other abdominal exercises too. Now, what this is doing is adding more contraction into the psoas. It's actually not a better form. The best form is to contract and to bring your chest down. That's causing more contraction through the abdominals. So if you see someone extending through the spine, that's actually not a great technique. The other one with the leg raises, the upper body is remaining in place and the legs are moving. The hip is still flexing because it's the hip flexors that are being involved. In some of these repetitions, you might not be able to see it very clearly, but my lower back is arching. So as my leg is coming down, my back starts to arch. Now, the reason this is happening is because as my leg is lowering down, the hip flexors are trying to lengthen, but also contracting at the same time. They're trying to lower your leg. And what's happening is the abdominals are not strong enough to keep the lower back pressed into the floor. So what's happening is the tension from the hip flexors is pulling the lower back, the lumbar spine, into extension. So that's why you start to get an arch in your lower back. Now, the correction for that is to make sure that your abdominals are really firmly pressed in or firmly contracted. And as you start to notice your lower back lifting off the floor, maybe just stop. Or in the clip I'm showing you now, what I've done is bent the legs so there's less of a leverage. So as I'm coming down, there's not so much weight for my abdominals to have to control. So that means I can do the same exercise without the lower back lifting off the floor. Now, in the case of the plank, as you can see from the clip, I started off in a perfect plank position, but as time went on, I went to more extension in the lower spine. And you'll see this with a lot of people. As they start to get fatigued, their abdominals will not have the same level of contraction and they will start to drop them. So which means that the lower back starts to cave in. And that's when you can start getting that compression through the back, and that can cause back pain as well. So both of these different types of exercises can cause back pain. One of these is through contraction of the psoas or the hip flexors, and the other is from compression within the lumbar spine. So what I'm going to show you now is some really simple variations that you can do to try and modify your abdominal training without getting lower back pain. I just want to quickly say thank you to all of those people who have supported the channel recently through either buy me a coffee or using the super thanks links. If you would like to also support this channel and help it grow, you can do so using the super thanks at the bottom of the video, or click on the buy me a coffee link in the description of this video too. So now hopefully you've got an idea of what's causing your pain. What can you do when training your abs? What can you do to prevent that coming on? So the first thing I would say is you need to modify your technique. So in the case of the leg raises, for example, rather than having straight legs, bend your legs. Just reduce the leverage. So reduce the length of the lever so it makes it easier. The second thing is maybe instead of doing it on the floor, try doing it on a Swiss ball or a Bosu ball. Now when you're doing it on a Swiss ball, here's what I would do. I would sit on the ball, walk my feet forwards walk my feet forwards and lean back until my lower back touches the ball. From here, I have my arms crossed rather than up here, because that'll make it more difficult. So I'd have my arms crossed or have my arms out in front of me. That's the easiest. That's the next easiest. Then I would come all the way down. I'd lift my head first, lift my shoulders, and keep rolling until I get to about there. As you can see, the top of the ball is supporting my lower back, but also I'm not using my hips too much to come up. So by flexing my spine and contracting and shortening my abdominal muscles, I'm moving from the abs and not from the hips. So I'm taking out the usage of some of those hip flexor muscles. So I'm rolling up and just maintaining stability through the legs, rather than lifting the chest and rolling the hips forwards, which is using the hip flexors. Another thing you could do if you don't have access to a Swiss ball is use a gym bench. Now for a lot of my rehab patients, what I do is I grab a bench and I will incline it just a little bit, and that way there's not so much pressure when they're on their backs. So from here, on an inclined bench, same thing, head up, roll the shoulders up, and continue that to about there, and then roll back. If this is done properly, even this exercise can be effective. So this is really good for people who can't get down onto the floor or who have got back pain. An incline bench is another great way of modifying exercises. The last thing is, if any of these exercises are causing pain, it could be due to a weak abdominal muscles. Maybe your hip flexors are just not strong enough. So if you are getting pain, say around the 8 repetition mark or halfway through your set, then stop when you start to get pain. As you get fitter and stronger, you can start adding in more reps. You don't always have to go to the end of that set just because the target is 10. You don't have to go to 10 if you can't handle that many reps. So if you are getting pain, maybe stop just before you start to feel the pain. And over time, as you get stronger, then you can start adding in more and more. I hope today's video has helped you. If it has, please give this video a thumbs up. If you want to support the channel, you can do so with the super thanks or buy me a coffee. And lastly, if you want to do something about your lower back pain, check out my ebook. The link is in the description below.